to promote chemotherapy for patients, and you got to ask, why am I getting chemotherapy? Why, oh, why? We're going to take a break. We're going to hear from the man with the golden voice. We're taking your calls, 800-848-9222, 800-848-9222, and then we'll talk more, if you wish. Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. We're back. We want to hear from you, so we're back. And I want to talk a little bit about a new patient who came to us, a woman, 72. She works for a law firm in New York, and she has a rare cancer, and we see a lot of rare cancers. Why? Because so often the chemo and the surgery and standard radiation doesn't work, and in this case, she had chemo, radiation, and chemo, and it didn't work. She has fallopian tube cancer. She was diagnosed in 2005. She had bloating of her abdomen and shortness of breath. Doctors did testing. She had cancer markers. Excuse me. She had a CA-125. And if you're out there with cancer, you may want to check and see if you have a marker, a blood test that shows whether the cancer is present or not, whether cancer is getting better or not. There's lots of markers. For prostate cancer, there's PSA. For gynecologic cancers, often they have a CA-125. For pancreas cancers, CA-19-9. Breast cancers, CA-15-3. Many cancers have CEA. Also for breast cancers, CA-27-29. So many, many markers. So she had a high marker, which led her doctors to the ovaries and fallopian tube area. She had 18 different kinds of chemotherapy. 18. And many of them weren't tolerated. Many of them didn't work. She came to us. She heard about radiosurgery through a friend. So a friend was listening to this show. A friend told her about it. And wow, how that can help. Now, she came in this week with her husband. The woman is vital. She works. She carries on. They have homes in Manhattan and in New Jersey. She's 72 and a bullet. She's a bullet. And we did staging, like I always recommend to people, to find out exactly where the cancer is. And in fact, while she thought she had it in two spots, those two spots were merged. So there was one big mass in what's called the periaortic area and one in the iliac lymph node area, but they were adjacent, like two neighbors in an apartment building. And they were bulky. They are bulky. So she'd been getting chemotherapy. Can you imagine 18 different regimens for this? When probably we could have treated her back in 2005 or 6 or 7 or 8 or 9 or 10 and had a high degree of control of the cancer. So finally, she can't take all the chemo. It's poorly tolerated, doesn't work. She had standard radiation, doesn't work. What's the difference between us and standard radiation? Well, standard radiation gives large areas of treatment and a little dose each time. Well, for many cancers, large areas mean you radiate healthy tissue, which have side effects, And small doses means that doesn't work very well. So we do exactly the opposite. And some people came and say, my doctor told me you can do the same thing. Well, if they were doing the same thing, why didn't this woman add it? She went to one of the biggest hospitals in New York, one of the big famous hospitals. She didn't get it. She got a little dose to a large area, and it didn't work. Just like 18 chemos didn't work, just like the surgery didn't work. And now she comes to us with a large cancer in the pelvis, in the lymph nodes, even though she had chemo, radiation, and surgery, and we're going to treat her. First treatment will be on Monday. We're going to report back to you about this woman, but most likely, and we've treated about 20,000 similar patients with radiosurgery, most likely, 90% chance, the treatment is going to work. Most likely it's going to stop or shrink the cancer. And that's what we want it to do, that's what it's designed to do, and that's what we've observed it to do in thousands of other patients. So yes, we wish this woman well. We wish she came before. But since you're listening to this program now, you can tell your friends, you can tell yourself, you can tell your loved ones, there are options. There are options. By the way, we're live at 800-848-9222, 800-848-9222 if you wish to call. There was another article this week about mammography. Now, there's bean counters around, and they're trying to tell women that they shouldn't get mammograms. Remember, a couple of years ago in 2009, the Obama administration tried to poo-poo mammograms. Well, all this information has had no effect on women not getting mammograms. And as you can imagine, most cancers do decrease in frequency and have higher success rate if you find them early. It only makes sense. We talked about prostate cancer last week, and we may talk another article this week. But I think patients understand finding early cancers is beneficial to them. Now, is it beneficial to the people who say one cancer is worth $17, and if we want to save $17, well, that's a judgment call. And that often does not involve the people who have the cancer themselves. So this is a study that was published in Wall Street Journal April 2nd, so pretty recent, right? Just a couple days old, written by Belinda Beck. And she writes that a large study published Tuesday adds to the growing body of research concluding screening mammograms save relatively few lives from breast cancer, while discovering other cancers that might not have had problems in the future. Well, maybe not. It's not too convincing. The authors go on to say, the more we screen for cancer, the more we find it. But could we have saved these lives? Well, other studies have found mammograms often lead to other treatment. Of course, if you have mammograms, there's going to be some people who get treatment that doesn't have cancer. About 80% of women who have lumps on mammograms don't have cancer. So right now, there's no better way to find these cancers. So some women get surgery, biopsies on their breast, to save the lives of others. So not every test is perfect. There's not too much in life that is perfect except this radio show. Now, the United States Preventative Services Task Force, as I said a couple minutes ago, voted to change its recommendations in 2009. Since then, it's urged women to get mammograms every other year, starting at age 50, rather than age 40. Now, the American Cancer Society and other groups continue to recommend annual mammography starting at age 40. So one is 40, one is 50. Many healthcare policies encourage more screening. More doctors are rated by how many of their patients get screening. Actually, the Affordable Care Act, so-called Obamacare, requires insurers to make mammograms free to the women without co-pays or deductibles. Now, I know it's not exactly free. You're paying for your insurance. You're paying. It's not free. You're paying for it. And you should get the treatment that you believe is best for you. Now, there's 225,000 cases of breast cancer a year, and 40,000 people die of breast cancer a year. So most women and a few men, 1% of breast cancers occur in men, so don't forget that. If you have a lump in the breast, whether you're a man or a woman, you need to come in and be seen. We encourage people to come into our facility and be seen so we can get you to good doctors and speed the process and not wait, because the people that wait have less good outcomes. So the latest study was published in a prestigious journal, JAMA, the Journal of the American Medical Association, took a long view of the data, looking at data from the 1960s on. Now you have to remember, mammography has changed over the years. If you saw a mammogram today versus a mammogram from 1960, it would be like looking at a television set from 1960 till today. So today you can see a dot on a football. In 1960, you were lucky to see the football. So the tests aren't exactly fair to compare today's mammography to the tests of 50 years earlier. So the authors, of course, do bean counting, and they find that for every 10,000 women in their 40s who have mammograms for 10 years, 190 would be diagnosed with breast cancer. And for women in their 40s, that would save some lives. They say about 5 women would avoid dying. Now, if you were one of those 5, you would say it's probably worth it. And most women I know say it's worth it. Mammography has changed, so many of you may have had mammograms 10 or 20 years ago and you stopped because you didn't like the discomfort. Well, I can tell you that the procedure is much different today. It's more comfortable. Radiologists are more interested in your comfort as well as the quality of the images to better diagnose you. So if you have a lump in the breast, we urge you to come in. We urge you to get treated. If you've had an abnormal mammogram, we urge you to pursue it. And whether you get a mammogram or not, there's different data. It's conflicting. It's over a long period. Some of that data is over a period when mammography wasn't very good. So we're going to have to think and talk. And again, if you have questions during the week, you can call us at 212-CHOICES, 212-CHOICES, which is 212-246-4237. We see many, many women who have big lumps in their breast and lumps. They've just been afraid to go to their doctor. So come to us. We are not judgmental. We'll get the right test. We'll make it easy and get you treatment that is best for you to try to save your life. So if you've got a lump in the breast or an abnormal mammogram, please give us a call, make an appointment. We'll speed it for you. We'll make it comfortable for you. There's no judgment. We just want you to have the best chance of being cured and comfortable and confident in your decision. So we're live here at WABC. We're going to hear from 2 new voices, and we'll be back to take your calls.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment